Boston is home to many of the best hospitals, health centers, and medical research programs in the world. Yet, there are persistent differences in the health outcomes and experiences between racial and ethnic communities.
Locally here in Boston, as well as in the state and across the nation, we've seen year after year data that tells us that the health outcomes for people of color are far worse than the health outcomes for white residents of the country, whether we're talking about asthma, diabetes, heart disease, breast cancer mortality, or other types of mortality. We often see a disparity. There's a gap. People of color within communities fare far worse than their white counterparts. And so many have spent a lot of time and energy to try and figure out ways to narrow that gap.
These differences are unfair and unjust, and are often referred to as health inequities. Most often people tend to attribute differences in health to behaviors, genes, or choice, but what they don't realize is that the social conditions that we live in shape our ability to make choices that affect our health. Resource-rich neighborhoods provide ample opportunities for healthy choices and offer conditions that positively impact health. Resource-poor neighborhoods, on the other hand, often lack the opportunities and conditions needed for good health. This unfair distribution of resources leaves Black residents and other people of color living in neighborhoods where there is less access to opportunities, such as fresh fruits and vegetables, open green space, quality housing, and employment.
The Boston Reach Coalition is a group of community residents, organizations, in partnership with the Boston Public Health Commission. We've been meeting monthly for the last 10 years, doing work to address health inequities for Black residents. So one of the major roles that we're playing is providing education in the community, because we feel like it's very important to be able to provide people the information that they need so they could take care of themselves.
Financing to keep track of what practices.
We've been doing this for several years, and people have come to the coalition to know that this is a place for them to feel safe to talk about their health, to be able to network and meet doctors at the table and meet people like themselves.
I like the meetings because I know that each time we meet, we're learning something and we're moving forward with what we need to do.
Raise issues that we want to.
You can just feel the energy of everybody's passion and everybody's dedication, and I always leave feeling just terrific.
I invited Reach to come to Madison Park Village to do a presentation on breast cancer, and later that evening I went home and did a self-breast exam and found that I had a lump in my breast. I had a mammogram 4 months prior to me finding the lump in my breast. The mammogram missed the lump that was in my breast. If I had not have advocated for myself, I would not be here today to tell the story.
As a health equity coalition, it's really been important for the REACH Coalition to have conversations that aren't just about personal behavior, that aren't just about telling Black residents in the city of Boston, how to change their diet and how to exercise more regularly. It's that, but it's also a really important conversation about how do we impact policies to improve the environments in which people live so that people have opportunities to actually be healthy and live healthy lives.
What is making us sick? What does it mean, and what does it mean about racism?
In the last couple of years of the coalition's work, we really shifted our focus to look beyond just the poor health outcomes that we were seeing in the community, but to also look at the root causes and to think about how the role of racism impacts the structures in the community, how racism impacts individuals, and ultimately impacts community and individual health.
Public housing is interesting how it doesn't allow a family access to his or her own apartment, so you have a doorway that everybody goes through.
Place matters when it comes to our health, because our health is shaped by more than just the choices we make. Our health is shaped by the environments in which we live in.
The coalition needs to be the persistent drumbeat around health equity and undoing racism, because we have to be the voice and we have to continue to talk about it until we have resolved the issue.
We're not talking about easy or quick fixes. We're talking about, very slow, incremental work.
We know that this is something that's important to us and it's important to my community that I still live in.
When we talk about health inequities, we're looking at a very complicated issue, and it's compounded by a lot of different factors. So as we start thinking about how we want to address it, we need to think about who's our partners, who need to be part of this conversation as youth groups or the education system or different factors that we know that really impedes health in communities. So we need to build these partnerships to improve conditions in which people live.
Collaboration is important. Not one person can do it. We have to have everyone's voice at the table. And REACH is where we can meet, that everyone can share their ideas and their concerns, and we can begin to tackle this problem.
We're all getting on the same float or boat or car or whatever it is, and we're heading in the same direction as a unified force. And that's what makes REACH so special.
Each community should have markets that have fresh produce, that has healthy choices for you. Each community should serve the needs of the residents of that community. Working together with all kind of organizations, we can start to solve this problem of health inequity in Boston.
In addressing health inequity, we all should care. It's not a particular agency, it's not a particular organization, it's everyone who is walking on this face of the earth.
Some of the achievements of the Boston REACH Coalition thus far have been the relationships that they've been able to forge over the years that I've been there. I've seen, and I've also saw coming in, that was part of the attraction for me and the appeal, was the relationships.
We've provided a lot of resources to the community. We linked them to resources in the community that they may not have known about before. We've actually taught people how to go down to the State House, how to let their voice be heard, that the people in the State House are working for us, that we deserve to let them know what's needed in our communities. One of the achievements of the REACH Coalition is to bring the community residents and Boston Public Health Commission together to develop solutions about health issues that the community faces.
I hope that we'll be able to build on our partnerships because we know that it takes many people to do this level of work. We want to reach out to youth. We want to reach out to businessmen. We know that we need to get people engaged in this conversation who normally isn't part of this public health discourse. But we got to remember that health is more than health care, and health is more than just the choices I make. That health is about what surrounds me, what shapes my life, those opportunities that people don't normally think about day to day, but that it exists. So I hope that this coalition will be here in another 10 years' time to really be part of this conversation and driving force to make change in these communities.
I don't want to see chronic diseases continue in our community, and I want people to be advocates for themselves and talk about the issues that are affecting them and not just let someone on the outside make decisions for them that are impacting their lives.
We just got to keep on working and keep on trying. It's not going to come into effect overnight. It's going to take a lot of planning.
My hope for the REACH Coalition is that the residents and partners and all of the members of the coalition will feel that we've really been a part of something. We've been a part of some really powerful change in the community on a policy level, on a systems level, and on an individual level, and then that change will inherently improve the health of the community.
My hope for REACH is that they continue the work that they're doing and educating the community on health issues.
I want to see a better quality of life in the future for my grandchildren and for their grandchildren.